Welcome, everyone. I'm going to give a couple more seconds to let everybody's audio connect. All right, I think we have everybody in. Happy Thursday. This is our integrated roundtable. We do these every month on the first Thursday of every month on a different topic. Appreciate all of you joining us. This is recorded and we do upload it to a site that can be accessed by other individuals, so just know that. And these are our personal viewpoints and not necessarily representative of MOPA as a whole, so also just know that. Today we're going to talk about provider self-care. There was an ethics training a couple weeks ago that MOPA put on in regards to self-care and how it relates to ethics. And we're going to talk a little bit about that. And so if you attended that, I would love to hear how that impacted you and kind of how you're integrating that into your day. But I also want to talk about how we as clinicians can encourage and motivate self-care in the spaces that we are in, as that being one of our tools that we can provide. So I think there's a different aspect that we'd like to take up today and add to that conversation. So first of all, I'll introduce the panel, and then of course this is a round table and we're not the only ones at the table. So as we go through and talk, I encourage you to engage with us as well. I am Chelsea Gillum. I am a clinical psychologist. I work for Burrell Behavioral Health. I am the system director of adult integration. So I integrate spaces that are mostly where they're treating adults. So internal medicine clinics. I also integrate college campuses, for example. So Dr. Lute, would you like to go?
I muted myself. Thank you, Chelsea. Hi, everyone. My name is Robin Lute. I'm also a licensed psychologist, clinical psychologist. I currently have been working at Kansas City University for about the last 4 years in our PsyD program. I'm the director of clinical training and part of MOPA's Integrated Health Committee, and very happy to be here.
And I'm Dr. Hannah West. I am a regional trainer for the Mid-America Mental Health Technology and Transfer Center. I'm based out of Omaha, Nebraska at the University of Nebraska Medical Center. I am also a provisionally licensed psychologist working at Sunflower Behavioral Health Clinic in Shawnee, Kansas.
Thank you all. So our format usually for these roundtables, we're going to talk a little bit about the research. We're going to talk about the topic at hand. So self-care, we're going to talk about ethics. We're going to talk about diversity. And then we're going to provide you some resources at the end. A lot of that, which Dr. West is going to pull up on the screen to show you some additional things that are going to be fantastic. So let's just start with this statistics and research piece. I'm going to throw out a statistic here that kind of stood out to me, and we can talk a little bit further about it. In a recent study, they said 80% of participants intended to be more mindful about regular self-care practices after the pandemic. However, 46 reported struggling to find ways to maintain their physical, mental, and spiritual health during the pandemic. So we know that this is wanted and needed and identified in 2020, right? We've seen more people interested in self-care, but what we're not seeing is that people understand exactly how to do that. What are your thoughts on that particular topic?
I can start. I think it's really interesting. The last year, we've seen this huge push for self-care and for treating yourself and mindfulness, and it's become very culturally relevant. We see it on podcasts and TV shows, on movies. And part of it is, the culture is telling us that self-care is doing just what makes us feel good in the moment. And so, it may be self-care to pick up our favorite, coffee drink on the way to work. And that may be a part of it, but it's kind of missing that piece where, that intention of missing, this is a structured thing that you have to put in place, and it's going to be a little bit different for everybody. But it can't just be, doing all of these little things.
I agree with you, Hannah, and sort of building on that maybe, or just connecting with that a little bit. Thinking about, it's an interesting time, of course, to be doing a presentation or a panel on self-care, given that we are smack dab in the middle of this pandemic, or maybe coming out, who knows? That being said, I think previously, it was pretty easy to define self-care or to think of self-care as that one time a year we went away for a few days on vacation, or a massage, or going to the spa and getting our nails done. And I think the longer that we're looking at what self-care really means, and learning to counter we all have a negativity bias. I think that it's really important to remember that self-care also requires practice. As Hannah said, Dr. West said, it really also requires being personalized and being flexible and being ready to change, so that what Chelsea's self-care plan looks like may not be what my self-care plan looks like. Yet we need to work from a sort of ecological framework to figure out, where do we get that support personally, in our community, through our organizations, to counter that really significant bias that we are more important and more successful when we burn ourselves out.
And going off of that too, as healthcare professionals, we often care about the self-care of others to the detriment of our own self-care. And so taking care of others and making sure they have the support that they need, all the while we're running ourselves ragged to that point of burnout. And so thinking the importance of us taking that time. I have some research here from 2020, kind of in the middle of the pandemic, and it was a survey of 340 therapists. And the results showed that, let's see, the average therapist, so almost all of them, experience moderate levels of vicarious trauma and moderate levels of, pulling in and taking care of other people to the detriment of themselves, and 15% experienced high levels of that trauma and didn't know what to do with that. And I think this will kind of pull into our later discussions too, but higher levels of vicarious trauma were associated with younger age, less clinical experience, and the negative online treatment experiences. So as we look at how our lives have changed over the last year, not only on a professional level are we not really we had to jump in and learn new things, maybe without the level of support that we needed to feel competent. And that is at a detriment to our self-care.
I just pulled some information for our company, and one of the questions that went out was, how did your team pivot during the pandemic? And as I was writing up kind of the changes that we made, I also reflected on their experiences, because so many of them are embedded in the medical system. And so for my team, not only are they pivoting with our particular organization, but they're pivoting in the organization that they're embedded in, and that was a lot. But then I think about our ER team, for example. They walked past COVID wings to go to work every day. And, those were blocked off for a while, and then they were overflowing into the hallway, and there were hazmat suits, and there were codes going off while they're trying to do their job. And so I think we often too underestimate just this last year, just the impact of the work environment and what it's had on our employees, and they haven't had time for self-care. One of the articles I looked at, it talked about physicians, and the biggest barrier for them is time. Like, they don't have time to self-care. They don't think they have time to self-care. And although it should be a priority, it just doesn't become a priority at all for them. And I think that's the same for our clinicians as well.
Well, Chelsea, part of what I hear, what fits for me, there's so much of this that resonates, is that, thinking about providers who don't or can't or won't sort of make time to prioritize their own self-care. Thinking about the World Health Organization redefining what burnout is, or giving it a new definition last year, in the hopes that potentially this could reduce some stigma, right? In one sense, that usually on our integrated teams, we can provide support to one another. And if sort of everybody's overwhelmed, or the behavioral health providers are also overwhelmed, they might normally support the physician colleagues or the primary care colleagues or the nurse colleagues. So I think redefining it and actually giving it a formal definition both reduces the stigma. And as we know, when we have a diagnosis, it can make it easier for a treatment plan. So not only does recognizing burnout as a condition sort of give that validation that, no, it's not just me needing to work harder, or, again, take one Friday off a year, that this is a real condition with definable sort of symptoms or a syndrome that we can also then use specific interventions, personalized self-care plans that do work.
Listening to you talk about, how medical health professionals as a whole are impacted and maybe are in more of a high stress environment, it really reminds me of the importance of organizational self-care and organizational well-being. And so it can't all be on the individual provider. I think that's a misnomer, that it is up to me to monitor my own well-being, because we all work in systems, and if those systems are set up for us to fail, if they're set up where we are overworked, where we're not given time to provide our own self-care, then we're not going to, and our well-being is going to suffer. And that, as an organization as a whole, we're going to have more burnout and see less effective work.
So how do we make systemic changes?
Isn't that the question? I mean, as a general person, so you've got to look at the top down and then also the bottom up. And so from the top down, I mean, we've got to get system leaders on board. We've got to get people who are those decision makers to understand how important well-being is and make room for it at that table. From the general practitioner working within the system, it's going to take a few steps. One is that you can be your own advocate. You can advocate for well-being as an organization. You can start by doing, your own personal well-being and modeling that for others in the organization. I was listening to a TED Talk the other day, and just a person who worked in the company, in the office, started this initiative where every day they would write something that they were grateful for, and put it on the wall. And then soon everyone in the building was starting to do that. And so that's more of one of those bottom up ways, but you're going to have to find a way to get some of that, those administrators, those people in charge on board.
Again, Hannah, I connect with you on that model I was sort of referencing earlier, the Bronfenbrenner social ecological model. And I hear you that we as individuals, we with our clients, our patients, our students, our colleagues, we absolutely can and should do, as you called, like grassroots level efforts and things individually. Some of that could include writing to legislatures, whether that's at the local, the government, or local, state, federal level, in terms of trying to get some bigger policies. Part of this reminds me, bigger policy change, and part of this reminds me of one of those experiments that just sort of happens, where at my university, Kansas City University, I have a great deal of respect for our CEO and president. And for the first time in a town hall about 1 year ago, I asked my first question in the full town hall and said, is it possible that we could do some work from home? I feel like I could probably do some of my job duties from home. And it was an absolutely no, we will all be on campus 5 days a week, and with friendliness. And, it's important for students to see our faces. It's, this is the model that we have. And not a week later, it's now been a year since I've been there, and I've still been working full time. So I'm not going to suggest we throw a pandemic in now and then. And yet at the same time, there is some unique data maybe, or something to be reflected on here, that we are able to do things quite differently than we get very stuck in our systems, and we can make such huge changes. And again, it reminds me of starting with early integrated care, where, there's a lot of convincing that you're going to have to put some time and resource up front, but the payoff, literally, physically, like your clients' outcomes are going to get better, your costs are going to get better. It's part of that convincing departmental levels, organizations, that you will have less absenteeism, you will have less burnout, you will have to rehire fewer times, you're going to save money, you're going to have healthier clients, your insurance is not going to be utilized as frequently when you have healthier I want to say providers or academicians or trainers, or so.
Absolutely. So the number that stands out to me, because I think this is a huge piece of integration, is it costs $500,000 to replace a physician. $500,000. That is a statistic that we can absolutely use to our advantage to talk about the importance of us being present. And I think the thing that we don't do well is saying that us being present alleviates a significant amount off the physician itself. We talk a lot about patient care because that's what we're taught to think about. But so much of that patient care piece is your provider able to spend more time with your patients? Are they happier at work? Are they spending more time going through the charts? Less time at home charting? Those are things that we track to try to see if we're alleviating some burden off the providers. But physicians have a higher rate of suicide as well. Like, these are big things that nobody talks about. And I think we're a great asset, but we have to start training our workforce to go in and that be a piece of what they provide. Is how can I encourage self-care amongst my colleagues in this healthcare system? And that's a tricky piece, because that's not billable, right? But that's important because it's 500 grand. There's a cost that's associated with providing that relief. And I think we need to tout that more often.
I think going off of what you are talking about now is the importance of our training programs as well. And when we talk about systemic changes that need to happen, should we be having our residents work 60, 70-hour weeks with, little compensation, and kind of give them that mentality that, like, this is what's important. And it's not important to take care of yourself. It's important that you get the job done. And it doesn't matter if you are working 14, 16-hour shifts, and then you have to do coursework on top of that. You still have to get the job done. And I think that having that mindset in training programs, and, residencies, internships, is a real detriment to our providers as they get out into the field, because, that's the mindset that they've lived with for the last decade in school. And so how do you switch out of that?
Well, and not only have they lived with that, they've been rewarded for that, right? We've all gone through it, our society, our culture, and I'm speaking broadly, I'm saying our society, right? We're all within our different subcultures and areas. We value, we glorify hard work. But more than hard work, right? We glorify this, I'm sacrificing myself, I worked all weekend. Somehow this makes you a better employee, right? Somehow this makes you more effective or more successful in the world. And so, as a director of clinical training, what you're talking about is really near and dear to my heart, because it can be, we are in this interesting place where we can either say, well, I did it and I lived and I'm okay, right? Or we can really look at what are the bigger outcomes here? Where do some systemic changes need to happen to make for healthier providers, right? Among other things, but healthier providers.
And I jotted down a few things that I thought, I just kind of brainstormed, how can we do that? How can we do that right now before we make that systemic change? How can we help improve the health of our physicians that we're working with, the ones that we need to be healthy for a variety of reasons? And one of the things that one of our BHCs did is she did kind of a did you know email every week. And it was a lot about self-care and did you know that burnout looks like this? Did you know that this reduces so much stress? And it was just kind of an informational email. And, I don't know how many people read it, but I do think there's ways that we can kind of reach them with just education pieces. We also had someone else that just did a book club in her hallway with the physicians that she worked with, and it really humanized everybody. So I think we can model good behavior. I think we can reflect feeling that we're seeing back to the providers when we see it. I think we can express empathy to them and how they're feeling. I think we can check on them. I think that we can talk to administration about how they want to address the population health of their clinic, and if there's a way that we can be an asset to them. Those are some things that came to mind for me. Does anybody else have any other ideas on how we can do this now?
I think a big part of it is modeling as well. And so modeling, taking that time, not glorifying working over the weekend, coming into work and talking to your physicians and the providers there about, how you had dinner with your family the night before, or, and, really modeling, taking that time. I think that's an important aspect of it.
I just posted via the chat. It's an older article about self-care, an action plan for self-care. Interestingly, of course, this is all the way from 2009. So we know that self-care we've always had a need for it, right? In fact, Chelsea mentioned earlier that there was a MOPA presentation on the ethics presentation was about self-care, that self-care is an ethical imperative. And so when we think a little bit about what unchecked stress can do for us or our colleagues, how it can impact our behavior, I think your question becomes really relevant, Chelsea. Are we waiting for, are there things, again, that we can do now? I don't know if people end up maybe getting overwhelmed sometimes with all of the resources then that are out there. I see lots of similar meetings kind of coming through about COVID, for instance, or resilience or grit. And I sort of have some new perspectives on those words as well, the more I think about them, in terms of, resilience is one thing, or having grit is one thing, and working yourself into the ground, or like using those terms as a way to sort of force this similar work ethic onto other people as we move forward. It just gives me a lot of pause, and I don't have an exact answer for you in terms of what can we do now. I mentioned I put that action plan for self-care, and it may be something that we can, as we've already mentioned, continue to model, do for ourselves, and help provide for our colleagues.
This just came to mind too, reflecting back on lots of therapy sessions that I had conducted. And so oftentimes when I was talking about how do we add in this piece for them, people immediately thought, add in, like, what can I add into my day? And I wonder if that's where people are getting stuck quite often, is I can't do self-care because it's an additional thing. Instead of thinking of self-care as also a removal of things, can we remove things? And especially for those individuals that feel stuck, I don't know how to move forward and add this to my life. Maybe we need to rephrase that and say, what can we remove right now or replace with a healthier behavior? Because I often think what do I need to add? I need to add in meal planning. I need to add in exercise. I need to add in meditation. I think of all these things that are adds, and I never think, what do I need to stop doing?
One activity that we have is this plate activity. And so basically, you have 24 hours in a day. You only have this one size plate. And think about all of the things that you do. And each of that gets a little sliver of the plate. I think about like a big Thanksgiving dinner. And so, lots of sides. So I've got a little bit of this, a little bit of mashed potatoes, a little bit of green beans, some, maybe a bigger portion of sweet potatoes. I like those. And so how am I kind of dividing up my plate between all of the things that are important to me? But the thing is if I want a little bit more sweet potato, if I want a little bit more time with my family, then I'm going to have to, there's only so much room on the plate. I'm going to have to take a little bit less of something else. And so really thinking about how that's divided up. And then I think a big part of this that we haven't mentioned yet is like that values-based living. And so when we think about self-care, there are a lot of things that we can do. There are those massages, there's the pedicures and all these things that, we may think of as self-care. But really, I think the big crux of it is what's important to me, what's important to you, and how do you live that out in your day-to-day? And I think a big part of values is that, they're not goals. So it's not, I'm going to meal plan. It's not, I'm going to exercise 5 times a week. It's, these adjectives. So like, I value, being healthy. And so in my day to day, I'm going to, value health. And so maybe that means while I'm working, I make sure that every hour I give myself 5 minutes to walk around because I value that. Maybe I value being present. And so if I'm at work, I'm fully present in whatever I'm doing here, but at home, I'm not checking my emails. I'm not doing these other things, but I'm fully present at home. And I think that that's a big piece of what self-care can and should look like that maybe our culture and our media doesn't get at very well.
Living congruently. Robin, you mentioned the ethics training. And so I'm gonna also send a link to that PowerPoint that was completed. That's gonna be available on demand as well. Great information in there, but let's talk a little bit about the ethics of self-care, why this is important, how do we recognize when it's an issue ethically, and I'll go ahead and post that link.
Well, thank you for doing that, Chelsea. I did enjoy I always enjoy Dr. Barnett. So if for those of you that have maybe had some exposure to him, I believe he's maybe a PsyD and a JD, maybe a PhD and a JD. But anyway, he's great. And he recently did the Missouri Psychological Association partnered up with him from APA and gave us our annual ethics training. And again, the topic of the entire talk was self-care is an ethical imperative. Again, reminding us that this is part of who we are. Part of what we do is to not just take care of other people, but to make sure that we are in a spot where we're competent and capable of discharging our duties appropriately. And so we all know that unchecked stress, distress, vicarious trauma, these all kind of work on a continuum. If we do not address them regularly or effectively, we do see our personal lives suffer, and often we see our professional competence I don't know if suffer, maybe suffer in some words, or at least get a little compromised, get a little questionable. And so it's just helpful to remember, I think, if we even go to some of the principles of from our APA ethics code of beneficence and non-maleficence, that quote, psychologists strive to be aware of the possible effect of their own physical and mental health on their ability to help those with whom they work. Okay, so it's certainly not something familiar or unfamiliar to us. I know that when I tend to think about big health issues that would be impacting my work, I don't necessarily think of it as stress or distress or smaller things, I guess. But burnout, distress doesn't happen in one moment. These are small things or big things or a combination that tend to build up over time. And so being aware of where we are emotionally is important and in fact essential to making sure that we are competently providing services and that we are competently representing the profession. So I think it's also helpful or important to remember that just because we're struggling does not mean we are not competent, right? So just because maybe you're having difficulty with the pandemic, I mean, imagine, it doesn't automatically mean you should cancel all your clients, go on disability. I mean, for some, it may get that significant. It's just a reminder that we need to be in touch with ourselves, aware of what we're doing so that we can stay, again, competent. We certainly are more prone to errors in general when we're more tired, when we're not paying attention, when we're burned out. We don't tend to pay as much attention to things. We don't look at details as much. It's easier to miss something. Yeah. I can certainly say more, Chelsea, but I'll pause.
One thing I thought of as you were talking was just the importance of having community around you. And so I think, especially as the pandemic has progressed, it's been really easy to, condense our world and just be in our own bubble, maybe with the Zoom screen, with some, some faces in the boxes. But as we think about, the ethics of self-care and how important self-care is and our competence levels, I'm reminded of the importance of those peer groups, whether it be mentors or even like peer level supervision, that we may used to have been able to get a lot more in the office, kind of going through and just sharing different parts of our day, but now we have to be a little more intentional about that.
I was thinking too, how do you know when you're at that level of that you're compromised? Because for so long we are taught you put everything aside and you work. And as psychologists, that's very difficult in our particular profession because you have to be fully present and aware while you're working. And so, if you argued with your spouse the night before and stayed up till 3 a.m. and then you come in and you try to work, nobody talks about those pieces either. Like, you have to really separate those two. Well, we get really good at separating those two. We get really good at just saying that's done and I'm at work now. And I think we miss that line when it gets crossed of, now it's too much. I've been ignoring this for so long because I naturally do that to get through my day that I don't even know where the line is. And I think Robin, Dr. Barnett spoke a little bit about that, and I think it's in that resource, but do you recall anything about where that line is or how to tell when you've reached that place?
Sure. I can give you some thoughts about it. I'm thinking about Dr. Barnett and a few of his colleagues had written an article, I want to say in 2006. So again, we know these aren't new concepts for us. They just seem so relevant right now. With burnout really reflecting specifically emotional exhaustion, a sense of depersonalization, so that sort of distancing and a decreased sense of accomplishment. And so those can be some of the hallmarks. Now, we may all feel some of those feelings at times. I think it's when you start to notice more and more consistently that you're disconnected from your work, that you're not receiving satisfaction, um, you're not really invested in the outcomes, you're tired, you're irritable, you're maybe more negative about work. That does not mean you necessarily need to immediately stop what you're doing. It probably means that you definitely need a check-in at the very least. And one of the things I think we all know in terms of healthcare professionals, psychologists, self-care is what we just mentioned a moment ago. There's so much peer-to-peer contact that in terms of taking care of yourself, consulting with somebody, if you feel like I'm getting burned out or I'm concerned if I'm burned out, should I be taking a break? It's really important to consult. It's really important to reach out. And I think there's an interesting phenomenon where as much as we need that more than ever, the ways that we can do that are more restricted than ever, right? We are back to our Zoom boxes. So even if I want to talk to, let's say, Hannah after work and say, I want to process this with you, we're back on the phone or we're back on Zoom. So it's an interesting catch-22 there. At the same time, I think consultation is probably the biggest kind of encouragement I would give for anyone who wonders about that question a little more specifically for themselves, Chelsea, that talking to other people, not being afraid to ask for help. Again, I think that's part of the WHO's change in definition to reduce that stigma that burnout requires that you, or if you're just moving towards distress, you need to ask for help. And again, we are often rewarded for not asking for help, not bothering our professors, not being good patients, just doing what we're supposed to do, quote unquote. I'm sure there are no type A personalities in here. So I'm not entirely sure if I answered your question, Chelsea. As you know, I'll talk. I'm a professor now. I talk.
No, that was great. And I think that's a great segue into this diversity piece, because self-care, you guys mentioned earlier, self-care looks a little different for every single person. Burnout looks a little different on every single person. That consultation piece is really important with somebody who knows you and can ask those questions in a good manner. But also I was thinking when it comes to the diversity piece of this, my first thought when I thought about diversity and self-care was, are the self-care regimens that are kind of thrown around and readily available if you Google self-care, are they culturally sensitive? And I feel like I see the same things over and over again, and they don't take into account the difference in people and who needs to access these. And I'm wondering if we leave a lot of people out by promoting these things that are add-ins that cost a lot of money, that are maybe more attractive to white individuals. What are your thoughts on that?
Yeah, I mean, I definitely agree with that. I mean, part of what you see, I immediately thought of like yoga and, having a subscription to a yoga studio, the supplies, all of these things. This can be really, really pricey. And just thinking about what that looks like, and even access to Google and access to, these search engines and online, that requires some resources. And so if we think not just about like diversity in gender or diversity in ethnicity, but also diversity in social economic status, we are really limiting what people have access to when we have these just typical self-care strategies. That include like, having a couple glasses of wine with dinner, or, going and doing those add-in pieces. And so really thinking, how are we defining self-care is important. And I think that, having it be that personal plan of some skills that are available to everybody is really important. And I think it comes back down to, what do you value and how can you prioritize that in your life?
Well, and part of what you're saying just it hits an interesting spot for me, because it reminds me that I have a place to advocate for others, and then it reminds me that, oh, add to list, advocate for others, right? I'm sort of kidding. I try to do that regularly. I am a big social justice fan. That being said, Hannah, you're hitting a huge, I think, a huge piece of the struggle, mentioning socioeconomic resources. We used an example of value-based earlier, talking about, I want to be healthy. Well, if you live in a food desert, if you do not have money to buy yourself healthy food, you can value health like that. You're allowed to value it. Yet if you can't get access to it, how much more burnout does that add, or how much more distress or traumatization does that add to individuals? So I think it is helpful to be aware. And I think we all also know that in non-COVID times, maybe still now, different racial, ethnic identities, different religious groups, different cultural subgroups will rely on different individuals within, let's say, the community. So some people won't consider traditional allopathic medical care or psychological care the same way we would. I'm assuming everybody here is open to psychological care, but maybe that's an unfair assumption. That many people utilize churches. There's been a lot around churches being open or not open during these times, and that's politicized, of course. And yet just kind of identifying that, there are prima donnas out there, or other local healthcare workers, or individuals at the community level that maybe have better strategies for sort of their subculture or their community in terms of taking care of themselves. But while our resources aren't distributed fairly, we're going to continue to struggle with having truly diverse, helpful interventions, I think.
I just realized when I think about self-care, all I think about are women. I don't know that I've ever heard a man say the word self-care. Are we reaching them?
Really interesting. My husband was quite content with a novel yesterday and not wanting to do some of the other things I wanted him to do. So I think he was engaging in self-care. I don't know if he would have said that.
I think about how we've termed things, and I think, especially in this last year, schools have been closed, and just the added stress added to families in general, but women specifically. And so, I'm a new mom, and daycare was closed the other day because the power went out, and they called me first. They've got mine and my husband's number on file, but they call me. And we see that there's research that tells us that women have been hit harder in this time period than the men have been. And when we think about people who are doing that online schooling at home, people who are having to split their time between maybe their online job and also monitoring the family and feeding the family and doing all of these things. And that's fallen disproportionately on women. And we are seeing more women exit the workforce now than we have in many, many years. And I think that is something that we're going to be continuing to fight back from for many, many years to come.
It's so true.
Minorities in general, right, have this extra layer of stress. And I think about race-related stress as well right now in 2020 specifically, but systemically for lifetime, and how that piece are, how if our interventions or our suggestions are not inclusive, then we're missing a huge piece of what needs to happen going forward. We have to do better. Let's move into the resource piece of this. I'm going to post some things, and I think Hannah is going to show us. She's got some access that is going to be really helpful. And I wanted to make sure we leave plenty of time for her to do that. And while she's doing that, I'm going to also post some links. So some of the things we talked about today and where those were accessed, and just other things that came about while I was doing some research.
Okay, as I mentioned earlier, I'm a regional trainer for the Mid-America Mental Health Technology Transfer Center. And one thing that we've really been, we're being funded through SAMHSA, and we received extra funding this year to really focus on professional well-being. Because as you know, a nation, we're knowing that this is an area that a lot of people need right now. And so we are using the adult resiliency curriculum or adult resilience curriculum. And what this is a 10 module with a little bonus introduction of very specific skills that you can take and practice to develop your own well-being plan. The first 5 are core. And so when we think about developing this plan, we need these pieces. We have to have this context. And this is where some of that organizational stuff comes into play. We've got to be able to have a supportive environment and a safe environment. And then really looking at our values, cultivating awareness through mindfulness, and then connecting with others. Then there are 4 supplementary modules. And these are also really important, especially I think about number 8, feeling good physically through nutrition, movement, and sleep. I think we talked earlier, of how if we don't have enough sleep, that's when we really see some deficits in our functioning. But each of these modules is what this curriculum is based on. We are releasing a webinar for enhancing health professionals' well-being mid-March, where we'll be really talking through modules 1 and 2. And then we have a couple different pages here. So specifically for healthcare professionals, we are going to be having a podcast coming out. It'll be about 30-minute episodes that you can listen to as you're cooking dinner or kind of on your way to work, just talking about practical ways that you can develop your healthcare strategies. And then we also have this page for educators. Our provider page or professional health will look more like this. We've just been working with the educators for a little bit longer. But if you want to look at some activities, down here, there are various activities that you can think about to try to cultivate each of these core modular areas. And it'll really help you create your own self-care plan, because I know, for me, the traditional view of mindfulness, so, taking those deep breaths, maybe doing some yoga is not very effective, but I do really think that grounding myself in the moment. So, that 5, 4, 3, 2, 1, where I'm looking for those things that I can see and hear and smell and bringing me into this present moment, that works a lot better for me. So my own self-care plan isn't going to include, closing my eyes and breathing for 10 minutes, but it is going to include, grounding my feet or taking a few minutes to notice my environment. And the skills here are designed to help you move through that at your own pace and kind of determine what works best for you. And I put the link in the chat box and it'll take you there. We have, various webinars, things like that. And then there's also a link to just the Mid-America or the Mental Health Technology Transfer Center at large, provider well-being. And so it has all of the upcoming events, products, and resources from across the entire MHTTC network, which is nationwide.
These are so amazing. It's something to be I'm so impressed by it, Hannah. I was looking at it again last night. I want to post it over all of my social media, tell all of my teacher friends. There's so much in each little module, like you were saying, not traditional mindfulness doesn't work for everybody. That's just such a great example. And you have so many different things. And I want to be clear, just in case, for those who may not know, as far as I understand, all of this is free, right? It's subs that you all went for it. And
Yeah, we're SAMHSA funded and everything we have is free. So the MHTTC is there are 10 regional networks, and we are all tasked with a different region. So the Mid-America serves Kansas, Missouri, Nebraska, and Iowa. But all of the resources across the region are free. We also do more intensive training and technical assistance. So if you are thinking as, provider in a system, and so if you want, assistance in how you can bring this system-wide to your integrated care system, or there are other areas that we work in as well. So MHTTC, we provide resources and training and technical assistance for integrated care in general, school-based mental health, serious mental illness. And so if you have questions about any of those things or how we might be able to collaborate or support, you can reach out to me, and I'll be able to kind of direct your questions to our team. And I'll put my email in the chat box.
Polly Freeman, is there any chance you want to come on and tell us about this wellness virtual seminar? I'm really interested in knowing what you're offering there. You don't want to.
Oh, well, actually, it's two things. We have, through the University of Kansas Public Health Department, they offer a workforce wellness where they come in and do trainings with like your entire clinic, and how to implement, just wellness practices all the way down from the folks that take the calls and scheduling to the physicians. And then the other one we've partnered, and her name escapes me. It's a physician who does wellness coaching. She's out of Alaska. I can't think of her name off the top of my head, but she's going to do, we're partnering with her, and she's going to do some virtual wellness sessions. I think we're going to basically, it's first come, first serve, up to 20, folks or physicians, clinicians, and she'll do a wellness seminar with them. And then the last thing is we're going to put together these wellness boxes. So if anybody has any ideas, we're just kind of like open to what would be really great self-care things that we could send to our providers in a box, just to say thank you, we're thinking of you. But so if anybody has any creative ideas, I'm open.
I love that idea. So I'm thinking how much people like free things, right? So, we were talking earlier, how can we reach these physicians and really encourage self-care? A box of things. I think that's it. That's
right. So we were thinking maybe some tea, some different kinds of teas, and we had even talked about like a robe or a journal. Of course, I said chocolate because you always need chocolate. Chocolate makes the world go around, right?
Yes. I love the idea too, if you add a tea and doing a mindfulness exercise with the tea that's actually in the box. Teach some mindfulness while they're drinking it. Let them really smell it and taste it.
Idea. Like on a card or like with instructions. That's a great idea. Thank you.
Although it's not free, you're making me think of, I do have something called a TheraBox that I get now and then. I don't know if any of you have a subscription box. It's cultivated by psychologists. So it literally has tea, journals. I mean, they're all it has a robe, fuzzy things, feel good thing, and they're literally chosen by psychologists. So if anybody wants it, I have a discount code, but I'm not saying it for that reason. It just really is made by psychologists. It's of course a privileged position to be able to spend $35 or something to get one. But
You have,
You have an idea there, Polly, for sure.
do you have a link for that where we could, I mean, look at
Oh
maybe.
yeah, let me look it up and throw it in.
I've
Okay.
got it. I was Googling it as you were talking about it. So
I got a spammed with it on Instagram the other day, so I know exactly what you're talking about because I fell for it and I went all down this Box rabbit trail and almost ordered it that
No,
day.
if you do, let me see if I can grab you mine because you'll get a discount.
Yes, I need to do that. All right, well, I want to finish up here and let you guys get back to whatever you have to do at 1 o'clock. Thank you all for being here. Again, next month, first Thursday, we'll post the topic very soon in the listserv, and I hope that you all return. Have a great month.
I'm going to email everyone with my link. Okay, thank you. It's great to see you all.
thank you.